Okay, this is part 3 of how to prevent a heart attack, and we were just talking about diabetes, how diabetes is primarily caused by eating dietary fat, especially saturated fat. It causes insulin resistance because it overwhelms the inner mitochondrial membrane electron transporters, especially sat fat because it's more reduced and it produces more NADHs that sends more electron carriers rapidly up to the inner mitochondrial membrane, and protons too rapidly get pumped into the intramembranous space. Right here is the intramembranous space. Here's the outer mitochondrial membrane, OMM. This is the inner mitochondrial membrane, IMM. The space in between the outer and the inner membrane, and here is called the intramembranous space. That's where the protons are pumped. These are the inner mitochondrial membrane electron transports. They pass electrons down from one to the next one like a fireman bucket brigade. And then these complexes here, complex 1, 3, and 4, pump protons. H plus is a proton. And at the end of the line, when you get to ATP synthase, complex 5 so to speak, it's going to harvest the gradient by allowing a proton to come back in. That's going to spin ATP synthase, and that's coupled to adding a phosphate to ADP, adenosine diphosphate, as in 2-phosphate, to become adenosine triphosphate. That's how energy is made in the human body, about at least 90% of energy in the human body. Okay, so when you eat fat diets, the fat overwhelms the cell, like the skeletal muscle cell, and it floods the mitochondria, and then it ends up shutting down electron transport because it overwhelms it with too many electron carriers. The gradient goes too high, and it starts to back up and go in reverse, and you start dropping electrons off a coenzyme Q down into the mitochondrial matrix. They combine with oxygen to form superoxide dismutase, free radicals. Okay, so the bottom line is fat overwhelms the mitochondria, and it starts going backwards. That's bad. All right, now here's what's supposed to happen normally with insulin. Insulin normally should bind the receptors on the plasma membrane of your skeletal muscle, and the majority of it should go into your skeletal muscle after you eat postprandial, okay? And when the insulin binds that receptor, and let me get myself out of the way, then that sends a signal for the glucose type transporters. They're sitting in a vesicle in the cytoplasm, that it should travel up to the plasma membrane, merge with the plasma membrane, and set these vesicles free within the plasma membrane to then function as channels to allow glucose to come into the cell. So that's how glucose gets into the cell. High blood glucose, recognized by the pancreas, releases insulin. The insulin goes to the skeletal muscle, binds the skeletal muscle, and tells it to send its glucose type 4 transporters up to the plasma membrane. So this is insulin-dependent glucose transport. Very important to know. You get the same effect with exercise, but that's not insulin dependent. That's why exercise is so great for everybody. Okay, now we're looking at insulin resistance. When you've eaten a high-fat diet, you get fat flooding into the mitochondria, overwhelming the mitochondria, and it sends out a signal called overnutrition, which blocks the glucose type 4 transporters from going up to the plasma membrane of the skeletal muscle cell. Now the glucose, which normally the majority of it would go into the skeletal muscle cell after eating so it can be stored as glycogen, now it can't get into the skeletal muscle because the glucose type 4 transporters are not up there. One of the things I do at night when I floss my teeth, I walk around a lot, and that will get me increased insulin sensitivity because the walking, the exercise, will send more of these glucose type transporters up to the skeletal muscle plasma membrane. But anyways, when you eat the high fat, you get insulin resistance and the glucose is stuck in the blood, so you get high blood glucose level, hyperglycemia. Okay, here's the concept of carbohydrate intolerance. So what this means is if you eat the fat first, the fat will cause insulin resistance. And then if you follow that by carbohydrates, then you get a big high spike that's prolonged in blood glucose levels. If you only eat starch, you get a little spike in blood glucose level, but not for very long, and it comes right back down. So this is eating fat is what causes carbohydrate intolerance. Dr. McDougall said people should not be counting their carbs, they should be counting their fats. All right, because that's what causes insulin resistance. Now here's another paper, and what it showed was that the more fat people ate, the more fat got into the skeletal muscle cytoplasm. There was nothing you could do about it. The fat was getting into the skeletal muscle by something called the flip-flop maneuver. It would come up to the plasma membrane, outer leaflet of the fat cell, the skeletal muscle cell, and then it would get protonated. It would flip into the plasma membrane, outer leaflet, and then it would flip across into the inner leaflet of the plasma membrane. It's a phospholipid bilayer. and it would come into the cell cytoplasm. They couldn't stop it. You could inhibit the so-called fatty acid transporters, but it didn't matter because the fat was getting in through flip-flop maneuvers. Like, based on its concentration in the blood, it would flood the skeletal muscle cells, and there's nothing you could do about it. There's no drug to block these fatty acid transporters. What you need to do is eat less fat. That's an important point because there's no medical surgical bullshitology way around that. All right, here's what's shown what happens at the capillary level. So here's a normal capillary up above. These are the red blood cells traveling through the capillary. Typical red blood cell is about 7 microns in diameter. Capillary is about 5 microns in diameter. These spindle-shaped black cells are the endothelial lining cells. The yellow is the capillary basement membrane. The green is the vascular smooth muscle cells. So the point is these little blue circles are the oxygen exiting from the red blood cell to travel to, let's say, a brain cell, a neuron. And this is the axon, the elongated part of a neuron. All right, well, anyways, when you get diabetes, you get thickening of the capillary basement membrane. With hypertension, you get thickening of the arterial wall, the vascular smooth muscle. You get collagen laid down in here as well. So that means an increased distance to travel for the oxygen from the blood, plus a pathway that's less friendly for it to diffuse through, so you get less oxygen delivered to the cell. So chronic small vessel atherosclerotic ischemic disease that accumulates over time with aging due to high-fat diets damages the ability to deliver oxygen to the tissues, predisposing those tissues to increased risk for permanent injury and degeneration. Okay, this was the vascular hypothesis of dementia by Jack Delatorre. Here's his book, Jack Delatorre's book, The Alzheimer's Turning Point, and it's a very good thing. So basically what he did was he tied off the carotid artery in a mouse. And when he tied off the carotid artery in a mouse in the neck, so this is a cervical carotid artery, the internal carotid artery in the neck. Middle-aged and older mice, 2 months later, would become demented. Young mice wouldn't. They had more collateral flow and more resilience. But middle-aged and older mice, 2 months later, they're demented. He first did an autopsy on the same side of the brain, ipsilateral, and there was no stroke. He was like, oh, that's interesting. The brain was just atrophic, shrunken, where he tied it off. So he did a whole bunch of variants. He tied off both carotids. He tied off, a carotid and a vert on the same side vertebral artery. That's what supplies the posterior part of the brain. Carotids supply the anterior part of the brain. And everywhere he tied off the circulation, he tied off the middle cerebral artery, anterior cerebral artery, everywhere he tied off the artery, that brain territory, the brain shrunk. Okay, so no stroke, it just shrunk. So what that means is when you have a sudden major occlusion of a vessel, the brain tissue dies, and then its plasma membrane lyses and it spills its contents out into the extracellular space, which is a big mess because it creates a big inflammatory response, antibody response, and then the immune cells come in there and try to clean it all up, and the adjacent cells, tons of them get destroyed for multiple reasons. That's why normally the brain has a filtering mechanism, so to speak. When a brain cell doesn't have enough ATP production to maintain itself, the microglia, the immune cells of the brain, will just eat it. And so the brain just keeps shrinking. And to shrink is called apoptosis, atrophy or apoptosis. Apoptosis means like a falling off of a leaf, like the leaves in the autumn. And it means that the brain cell's dying but not making a mess. And the reason it's not making a mess is because immune cells are eating it and recycling it. And they want to eat it and recycle it before it bursts, because that way they can kill it individually without making a big mess, damaging the adjacent cells in the brain. Does that make sense? You avoid collateral damage. Okay, so anyway, somebody first learns about, you tie off the carotid and the brain shrinks in the supplied territory. Well, whoop-de-doo. How many patients have a carotid artery severe stenosis or occlusion? Not that many. But guess what? Tons of patients have this problem of cerebral hypoperfusion. If you have hypertension and you overtreat it, you drop perfusion to the brain, mouse equivalent, but that's a global mouse equivalent, okay? If you have chronic hypertension that's severe and poorly treated, so it's too high the pressure, then you'll get atherosclerosis, ischemic disease, like I just showed you in that last slide. Same thing with diabetes. You damage the microvasculature of the brain. You can't get oxygen to the cells. You're like the mouse. Okay, so you're damned if you do, damned if you don't with hypertension. If it's severe and you don't treat it, it damages the artery, causes atherosclerosis, causes ischemia. Ischemia is lack of oxygen delivery. If you overtreat it too low, you drop the pressure. I mean, why do you have a blood pressure? To get blood to your brain. So if you drop it too much, then you don't get blood to the brain. Most common reason these old people fall, old guy fell, hit head. I see that, 10 times a day for head CTs. You're causing the same problem. Congestive heart failure, you can't pump enough blood to the brain. mouse equivalent, global mouse equivalent. Atrial fibrillation, 25% drop, you lose the atrial kick, mouse equivalent, okay. Aortic stenosis, aortic valve disease on the heart, aortic regurgitation, you're like the mouse. Go for open heart surgery, CABG, coronary artery bypass graft for coronary artery atherosclerosis. They run him hypotensive post-op. They ran my dad like 95/60, so he doesn't bleed it as anastomosis, the plug-in sites of the arterial grafts. You're like the mouse. That's why a lot of people get cognitive decline after vascular surgery, at least like 15% or more, and that's called pump head. Okay, here's sort of showing what I call the Goldilocks relationship of the brain. And here is the internal carotid artery coming up into the brain. It's going to have an anterior cerebral that runs down the midline. I didn't draw because it would be too complicated. I just drew the MCA, middle cerebral artery. Comes up over the cerebral convexities, and then it drops these penetrating branches, okay? And here's the watershed area. This is the periventricular region called the corona radiata at the level of the lateral ventricles. Just above it's called the centrum semiovale, the center of the brain, semi-oval in shape on an axial image. Anyways, these penetrating arteries are, for the most part, end arteries. So this area where I drew the skull and crossbone, it's not well perfused, even under good conditions. So when you start diminishing blood flow through these penetrating arteries, you'll stroke this area. In one given day, I could see 1,000 strokes in this area, because the same patient could have hundreds of little tiny strokes in the periventricular regions. Okay. Don't get me wrong, most demented patients don't have that many strokes, but I'm also telling you, lots of people are walking around with over 100 little strokes, and that's not good for them, okay? So you drop the pressure too low, you stroke out the watershed area, okay? Pressure's too high, you'll often get a lacunar infarction right here. These are called the lenticulostriate arteries going to the basal ganglia. Ganglia means nuclei, cell bodies of neurons, okay? Basal means the bottom of the brain. This is considered the bottom of the brain in terms of the supratentorial brain. All right, now here's leaky gut. We're not going to get into this in much detail, but the bottom line is when you have leaky gut, you're predisposed to forming blood clots, because leaky gut means a lack of tight junctions due to a lack of dietary fiber or eating things toxic to the gut lining. Bacterial endotoxins get into the blood and they cause clotting, and those clottings can plug up arteries. Okay, we talked about it before, the gram-negative endotoxin, LPS, gram-positive bacteria endotoxin, LTA, lipoteichoic acid, lipopolysaccharide, as well as excessive free iron overload, which tons of people have. All of those things will distort the shape of fibrinogen, the blood clotting protein from alpha helix, which is like a cylinder, like a slinky, to become flat, like a beta-pleated sheet is called, like a deck of playing cards. And then the beta-pleated sheets will bind with each other, and then the molecular weight of the molecule goes up. The higher the molecular weight of the molecule in aqueous solution, the plasma, the blood, the more likely it is to precipitate, meaning to clot. And those clots, 2 to 200 microns, these amyloid clots they're called, because that's an amyloid transition to change from alpha helix to beta-pleated sheet, secondary protein structure. Those amyloid clots are 2 to 200 microns. They plug up a lot of arteries, and they can cause brain damage, stroke. They can cause atrial fibrillation, congestive heart failure, cognitive decline. Okay, we're not to go into all the details about mitochondrial inhibitors, but I'm the person who figured out that there's 120 of them, and they're obviously bad. Just like we know that mitochondrial inhibition causes diabetes, it also accelerates aging, and it also increases the risk of cancer. And it's very routine that the average American pro is on 10 to 20 of these things. There's lots of common things that are mitochondrial inhibitors, the preservatives in processed food, antidepressants, antipsychotics, lots of antibiotics, alcohol. Okay, so double whammy. I'll show you just one more slide for this session here. Normal coronary artery is on the left coronary artery is largely a bifurcation. These are the epicardial coronaries, the big outer ones that everybody talks about. These are the only ones you can see on cardiac cath that you can see well. So the left main bifurcates into the circumflex and the LAD, left anterior descending. Okay, so these are the epicardial big coronaries. Then you got these intramuscular penetrating arteries, the small arteries, the microvasculature. The reason I'm showing you this is that sometimes people have a normal variant where the left main, by the way, is called the widowmaker. But the left main, instead of bifurcating like normal, it'll trifurcate and have something called a ramus intermedius. The bigger the artery, the easier it is to bypass through, the easier it is to stent. So what I'm saying is a lot of people have a ramus intermedius. I forget the exact percentage. I think last time I remember it was in the ballpark of 20%, 25% or something. It's going to be harder to stent one of these smaller arteries than one of these bigger arteries. And these same patients have an increased incidence of myocardial infarction. So what I'm saying is you don't know if you got a ramus or not. Just assume you do and be healthy, eat healthy. Okay, I think that's all I got for now. I hope you found that helpful.